Welcome back. I'm Dr. Carrie Elliott, and today we're going to talk about feline diabetes. To begin with, let's define diabetes. Diabetes is the relative or absolute resistance to insulin in the body. Insulin is produced by the pancreas by specialized cells called beta cells. And they produce insulin, and the insulin helps to facilitate the movement of glucose into cells that's needed for each and every cell to do its job. So in particular, we're going to talk about kitty cats. So to begin with, what predisposes a kitty cat to developing diabetes? The number one predisposing factor for kitty cats to develop diabetes is obesity or being overweight. When a pet is overweight, the excessive fat cells increase their resistance to their body's own insulin. So over time, they have high glucose levels in their blood. These high glucose levels in their blood negatively affect those special beta cells in their pancreas, decreasing their ability to produce insulin. So you end up with a diabetic kitty cat. What does a diabetic kitty cat look like? Well, you'll notice that they're drinking more and therefore urinating more. Their litter pan will have large urine balls in there and fill up more frequently. They also will have an increase in appetite, yet they'll be losing weight. Sometimes, in more advanced cases of diabetes, they will get weak in their back legs. We call that a plantigrade stance, and that's indication of something called diabetic neuropathy. So what do? We take our pets to the vet to have a look. And when you arrive, the veterinarian recommends a blood test to check and see where their glucose levels are, and to check their urine and see if there's glucose or something called ketones in their urine. When they check these things and they confirm that they're diabetes, they're going to talk to you about a couple of different things. Number one, they're going to talk about nutritional management. What does that mean? Kitty cats, in general, are obligate carnivores. They like to eat meat. They like what we would consider a keto diet. They like to eat high protein, low or no carbohydrates. So they're going to talk about getting your kitty cat on that specific diet. They're also going to talk to you about getting your pet a little bit more active, playing more, getting laser tag or getting a feather, helping them to move. The more they move, the more they're able to see their insulin. They're also going to talk to you about insulin injections. So injections sound scary, especially if you're not in the health profession and you think, I have to give my kitty cat a shot. That can be scary. I'm going to put some links of some different videos at the end of this video to help show you how to give injections as well as to check glucose on your own kitty cat at home. So stay tuned to the end of the video and we will show you some links to those particular videos. So to continue, they're going to talk to you about insulin. Now, in veterinary medicine, we have two different kinds of insulin. We have insulin that can be measured with U100 syringes and insulin that can be measured with U40 syringes. So it's very important to understand what kind of insulin your pet is on and what syringe they require, because you can overdose or underdose if you're using the wrong syringes. So make sure you ask those questions when visiting your veterinarian. In addition, they're going to talk to you about timing of the feeding. A lot of owners like to feed their kitty cat all day long, meaning they leave a bowl of food out and occasionally they'll give them a little bit of canned food. Multiple studies have shown that kitty cats with diabetes have better glycemic control if fed once a day. So that means that if your kitty's eating all day long, going from unlimited access to food to only getting fed once a day might be a huge shock to your kitty cat system. So it is recommended that you talk with your veterinarian and establish a good feeding plan that's going to benefit you and your pet. So again, talk to your veterinarian about your specific kitty cat's needs. Kitty cats that have diabetes are similar to humans that get type 2 diabetes. What this means is that they can go into diabetic remission, meaning they don't necessarily always have to be insulin dependent. Once you get their diet under control and you get them on that high protein, low carbohydrate diet, feeding them at regular intervals, they sometimes become more sensitive to their own body's insulin and their beta cells begin to make their own insulin. That's why it's critical once a kitty cat has been diagnosed with diabetes, if your veterinarian starts your pet on insulin, that you make sure you follow up with your veterinarian for follow-up visits to check their glucose levels, as kitty cats often can begin producing their own insulin. Once a kitty cat's beta cells begin producing their own insulin again, it doesn't necessarily mean that they're out of the woods. It is important that they get monitored every 6 to 12 months to make sure that they haven't become insulin dependent again. Once a kitty cat has become diabetic, they are considered diabetic for life. They just might not necessarily need insulin for life, but they do need to continue to be monitored. Along with needing insulin, diabetics are predisposed to having certain issues such as urinary tract infections or skin infections. So it is very important that you see your veterinarian regularly to have tests done. I would recommend that you speak with your veterinarian to find out the cost that they would anticipate being involved in managing your diabetic kitty once your kitty has been diagnosed with diabetes. So when we talk about insulin and we talk about giving different injections, let's talk about some of the handling of the samples. Insulin comes in a bottle. It is live cells inside that bottle, so you don't want to shake it. I don't have a bottle here with me, but you want to roll it. So you roll the insulin between your hands to help mix those live cells up. Once they're mixed up, then you will drop your insulin. And I know that once a pet has been diagnosed at our hospital with diabetes, we schedule an appointment with the pet and the pet owner to show them how to give insulin, and we have the pet practice with sterile saline in the hospital giving their pet injections. And that can be very helpful for them to understand. Next, we get to monitoring. Once your pet has been diagnosed with diabetes, it is important that a follow-up visit be made in about 7 to 14 days after beginning treatment. And that's going to give the doctor the ability to see how the pet is responding, if we need to adjust insulin, if we need to add additional treatments, because not only do we change the diet, we also put them on insulin in the very beginning, and sometimes we put them on an oral glucose modulator, and that helps their body to be more sensitive to their own insulin. So when they recheck at the 2 weeks, it lets the veterinarian understand how the pet is responding to the therapy and help them to modify it according to your pet's needs. Now, if your kitty cat is like many kitty cats and they see that carrier and they get super stressed, stress causes a pet's glucose levels to jump through the roof, so they go really, really high. So it is important that we decrease the stress of coming to the vet. So I'm going to give you a couple of tips on how to do that. So if the kitty cat sees the carrier and runs and hides under the bed, right in the center of the bed where you can't quite get them, and you end up having to call the vet and say, oh, I'm not going to make it today, I can't catch my kitty cat, he ran underneath the bed. Then let's start desensitizing the kitty cat's fear of the carrier. The best way to do that is treats. If your kitty cat's diabetic, they love to eat. So I would recommend pulling the carrier out and putting it inside the house and letting the kitty cat see it. And after it's been there for about 3 to 4 days, I recommend putting some food next to the kitty cat's carrier. That way the kitty cat says, ooh, food, I like food. Well, I guess the carrier's not that bad. And they go and they begin to eat near their carrier. If after 2 to 3 days of that, open the carrier door and open the top of the carrier bag and put the food inside the carrier. And after the kitty cat goes in and eats, the kitty cat's not going to be as scared of the carrier. That will decrease the stress of coming to the vet. If once the pet gets in the car, they get a little bit nauseated and they get more frightened when they get to the vet, I would encourage you to talk to your veterinarian about oral medications that will help to decrease the anxiety associated with traveling to the vet. This can greatly help the veterinarian be able to understand where the glucose levels are in your diabetic if we're not getting that stress, what we call hyperglycemia, or boost in their glucose. So hopefully this is helpful. I am going to put some links at the end of this video to show you some areas where you can learn how to give insulin injections online, as well as how you can monitor their glucose at home. If we are monitoring the glucose at home, the ideal area is you want to get them between 150 and 300 on your glucometers at home. If you have a glucometer at home, I would encourage you to take it to your veterinarian and have them help you calibrate it, and they can set you up with when you should be drawing blood glucoses, how frequently, and from where. Plus, you can look at these videos and that can be helpful. Common places that we draw from the blood at home to get blood samples would be from the ear tip or the pad of the paw. When we do it in the hospital, we do it from drawing from a vein. So that usually requires at least 2 people, one to restrain and one to draw. Last but not least, let's talk a little bit about things to look for at home that might be concerning. Our biggest concern when dealing with a diabetic is hypoglycemia, or low blood sugar. What does a kitty cat with low blood sugar look like? They're a little bit more lethargic. They kind of act drunk. Sometimes they drool, they lay on their side, they have seizures. If this happens, immediately get some table syrup, some Karo syrup, and put it under their tongue or in their mouth, and this will help to bring up their blood sugar. And see your vet immediately. Stop any insulin. Do not give any more insulin if you get to that point. So again, if they're lethargic or drooling, or if they have a seizure, it's most likely hypoglycemia. Give them sugar and get to your vet or an emergency clinic as soon as possible. So let's review. What are some risk factors that increase a kitty cat's chance of getting diabetes? Being overweight. So weight control is a huge thing to help to improve a pet's ability to go into diabetic remission. So if we can get the pudgy kitty that has become a diabetic to lose some weight and get down to the goal weight of a body condition score of 2 to 3 out of 5, then that will help that kitty cat's chance of having a longer, healthier life. Routine visits with a veterinarian to check for things like urinary tract infections or dental issues or other things that can complicate the diabetes. In addition, having them on proper nutrition as well as the weight loss. So you want them to be on a high protein, low carbohydrate diet. Trying to minimize their frequency of eating is ideal, but each case can be different. So speak with your veterinarian what works best for your pet's health. And then regular monitoring either at home or with a veterinarian. If you are doing at-home monitoring, it is imperative that you keep correspondence up with your veterinarian so they can help you to regulate your pet's diabetes. And then lastly, we want to minimize stress for your pet when coming to the vet. And so we went over a couple of tips of how to make them less scared of the carrier, as well as even possibly using oral medications to decrease their stress levels. So hopefully this helps you understand a little bit more about your kitty cat's diabetes. And if you want to click on the links at the end of this video, you can also find some helpful tips on how to give insulin injections, as well as how to monitor your pet's blood sugars at home. Thank you.